Hi, I'm Vincent Atchity, President and CEO of Mental Health Colorado. I'm here today to talk about Care Not Cuffs. It's hard enough to be a human. Just the natural facts of life from birth to death give plenty enough cause for mental health distress. But as a society, we make matters dramatically worse at the intersection of mental health and criminal justice. This is where we take some of our most inhumane and most costly missteps. Care Not Cuffs is an effort to build the will to apply the known solutions. Mental Health Colorado is the state's leading advocate in promoting mental wellness, ending shame and discrimination, and ensuring equitable access to mental health and substance use care. Care Not Cuffs is the slogan and hashtag we're promoting nationally to accelerate community transformation. We can't keep doing things the way we've been doing them. What we need is to wholly embrace care, not cuffs, as the guiding principle for the coordination of our efforts and resources. As health advocates, we care deeply about public safety. Public health and public safety, after all, are two sides of the same coin. We care less about law enforcement. We can and should be changing laws as needed in order to promote public health and public safety. What we want are more cops who are committed to public safety, who de-escalate crises, keep the peace, and contribute to the well-being of the communities they serve. We want care, not cuffs, to be the priority in policing. The problem is that right now we get more cuffs than care in response to our health needs. Jails and prisons have become the largest mental health facilities in the nation. Calling 911 for a mental health emergency far too often results in a law enforcement response, justice involvement, and a heightened risk of injuries and fatalities. The public doesn't understand mental health, the need for access to care and support, or what happens in the absence of that understanding and access. By turning up the volume on public demand for care not cuffs, we will accelerate transformations that are already underway all over the country, here and there, thanks to the efforts of local heroes. Care Not Cuffs identifies these heroes and their efforts, holding them up as models for accelerated change. As parents, we've come a long way from managing kids by cuffing their ears. As a community, we need to catch up and care more readily than we handcuff. The ever-growing list of local heroes whose actions and operations demonstrate that we know what to do and what needs to be done is ever-growing. No further investment is required in research or finding a solution for the problem. What is needed is national commitment to implementing what is known to work. When we think about what humans need to thrive, to experience healthier minds across the lifespan, there is no serious disagreement. We know that when the right supports and services are accessible across the lifespan, support for children, access to housing, employment, and quality care, we yield healthier populations and prevent crises. Care Not Cuffs is public health and public safety in action. Local heroes, public safety officers, and clinicians are keeping people from getting arrested in the first place by providing appropriate crisis response and by taking evidence-based steps in meaningful health promotion and disease prevention. The CAHOOTS program in Eugene, Oregon is a perfect example of Care Not Cuffs heroism. CAHOOTS has inspired many other communities to launch similar programs. A mental health crisis is a medical emergency that deserves the same level of response as a heart attack or stroke. Care Not Cuffs and crisis response provides a health-based response to healthcare needs, reducing the stigma and harm that result from untrained law enforcement engagement. Padres y Jóvenes Unidos in Denver, Colorado is another perfect example of Care Not Cuffs heroism. Children's disruptive behavior is more often an indicator of an unmet mental health need than an indication that a kid is inclined to delinquency and criminality. School staff should be well trained in recognizing and supporting children's developmental needs and acknowledged for efforts to reduce the use of harsh and inequitable disciplinary practices. The NYPD provides yet another example of Care Not Cuffs heroism, their community policing program. Community policing exemplifies Care Not Cuffs philosophy and is based on an understanding that keeping the peace is paramount and that police are at one with rather than at odds with the communities they serve. As Judge Steve Leifman in Miami, Florida, one of our national advisors, understands better than most, we're getting it all wrong if we're waiting until someone is involved in the justice system before we meet some basic health needs. But justice system leaders, judges, district attorneys, and public defenders stand out for their heroic efforts to identify unmet health needs and provide pathways to care rather than criminalization and incarceration. Heroic communities all over the country are demonstrating a commitment to Care Not Cuffs by developing permanent supportive housing. Cities that have developed this sort of housing spend 2/5 what is otherwise spent on crisis interventions, law enforcement, and the justice system. Because jails and prisons are the nation's largest mental health facilities, we see some exemplary care not cuffs heroism in our departments of corrections. Leaders like Dean Williams in Colorado and Colette Peters in Oregon know better than anyone that the adults in their custody are often people with great mental health needs that have gone unmet over a lifetime. Care not cuffs practices and corrections meet those needs so that adults improve health and behaviors over the course of their confinement, preparing them to return to their communities successfully. Heroes at the Second Chance Center in Colorado, and our national advisor and hero Stanley Richards at the Fortune Society in New York exemplify care not cuffs by facilitating successful reentry into the community for individuals with unmet health needs, with vocational, housing, healthcare, and an integrated array of case management supports and services. Care not cuffs is all about saving people and saving costs. There's no one who doesn't care about one or the other. Care not cuffs is a nonpartisan win all around. We need to shine a spotlight on care not cuffs heroes all over the country. We'll build public will to apply known solutions faster if we can engage other people in calling out care not cuffs heroes as well. Tell us about it. Hashtag it on social. When you see it, say it. If you're calling for help, be very clear about the kind of help you want, that you want care not cuffs, so that you give dispatchers a chance to get it right. We know what to do. Building a movement is about communications and marketing. With more funding for public and leadership education, marketing, and advertising campaigns, we can make this happen. Please visit the website carenotcuffs.org, sign the petition, use the hashtag when you see it, say it, be a part of this. Thanks for caring.